Assalamu alaikum jami'an. First of all, I'm very happy to be here, and I would like to thank Dr. Ashraf and Dr. Duran and the organizing committee for inviting me for this talk. So I was very happy to be invited here to talk about breast cancer screening, and when I saw the topic that talk about breast cancer screening from different perspective, so I thought like to give a summary of what I've done in Jordan. I will talk mainly about breast cancer in Jordan, our experience in the King Hussein Cancer Center, the Jordan Breast Cancer Program, and we'll share some data. Breast cancer in Jordan, I am personally a radiologist, breast radiologist working in the King Hussein Cancer Center in Jordan. I am the director of the breast imaging unit. So breast cancer in Jordan is a small country, as you can see, with 11 million population. And it's a very small number compared to what Dr. Nuran already shared. We used two sources of data in Jordan. We had the breast cancer registry, which was established many years ago, but of course the data collection has improved significantly, and also our own KHCC registry. As you can see in Jordan, this is data from 2016 and 17, the same number. Number of breast cancer cases diagnosed in women was about 1,260 cases. And you come to the next common number is colorectal. In female is 300. So there's a big gap difference between the number of cancer cases diagnosed in breast cancer and the next most common cancer, colorectal cancer. And also if you see in male, the most common is lung cancer. So this gap in number makes the breast cancer diagnosis in Jordan is an issue because it's the most common cancer affecting women and of course the lives in Jordan. As you can see the trend over the past years, there's a gradual increase in the number of cancer cases in Jordan. And the most common affected group is between the number changed into Arabic, I'm surprised. Anyway, between the age of 40 to 60, this is the most common number of cases. And this data from the 2011, you can see that the higher stage cancer, 3 and 4, is representing the most of the cases. And 2015, we started to see more case 0, the in situ, the localized disease, and the regional disease, more like stage 0, 1, and 2. And again, the most common cases presenting to our center in King Hussein Cancer Center is about 1,000 cases are breast cancer. From here came the vision of our institution, King Hussein Cancer Center, to focus on the breast imaging services. The center was established in 1997 and was named Mustashfa Al-Amal, or Markaz Al-Amal, the Hope Center. But in 2002, the Queen and the Queen Abdullah and Queen Rania decided to change the name into King Hussein Cancer Center because, as you know, the belated King Hussein died of lymphoma. So the idea was to give more hope and to encourage the people to talk about cancer. So now they call it the King Hussein Cancer Center. It's more practical to use the name to make people less afraid of the name. In our center, we started from a small mammography unit with one mammography machine, and now we have 3 components. One were the diagnostic center in the old building, the new expansion, and the early detection unit. I would like to stop here for a second to say that if you want to do screening mammogram, you have to have the comprehensive breast imaging services. So you have to do the proper quality of a screening mammogram, you have to do the proper comprehensive diagnostic workup, you have to do the biopsy, the ultrasound, the biopsy. If you need to do further workup like MRI or MR biopsy or stereotactic biopsy, you have to have the full range. So if you are doing a screening in a primary center, you have to know where to refer your patient for the further diagnostic workup. You cannot leave the woman in the middle that you have something suspicious and we cannot do further. And if you can't do this, you should not do screening mammogram because you are giving false assurance to the woman that she has a negative mammogram and she can come later. So comprehensive breast imaging services or a unit, even if it's a referral center, you are not doing it as a primary care, this is a must. You must have if you want to do screening mammography in the sense which we know about. So now it's a small number, and compared to Egypt, we have now full field digital mammography, about 5. One of them DBT, one is contrast enhanced mammography, and 2 mobile units with full field mammography. And from this also, our center worked on getting accreditation, national recognition. It was the first center in the Middle East in 2006 to get the Joint Commission International Accreditation, and continued to get for the BAB, for the lab, for the nursing, and something developed also, I will talk about now, the best specific unit accreditation to guarantee quality. And talking about breast cancer in Jordan, we have to mention the efforts of the Jordan Breast Cancer Program. The Jordan Breast Cancer Program is led by the King Hussein Cancer Center and Foundation and the Ministry of Health. So what was the idea? They have conducted similar to what you have conducted in Egypt, like a situation analysis. They wanted to see what we have in the baseline. This started in about 2009, 2010, start to collect the data. So we had an inadequate infrastructure. There were fragmented resources, like some centers different from the other. We have limited awareness of breast cancer, lack of standardized care, shortage of trained healthcare provider, whether radiographer, radiologist, pathologist, surgeon, large late stage of breast cancer diagnosis, as I have already shown. So this had required to make a body which will govern and facilitate the efforts of breast cancer screening in Jordan. As we know, screening, when we talk of screening, it means early detection. Now, about the situation in Jordan, they decided to do what they call as a late down staging, or try to find cancer at an early stage. If we cannot do a proper mass population screening, let's try to decrease the stage of diagnosis of a breast cancer. They call it down staging or early diagnosis. Now, the Jordan breast cancer approach, which was followed, first thing, you have to provide the service and guarantee the quality. So you have to work on these two components: service delivery by infrastructure equipment, human resource capacity, and providing opportunistic screening until a national program based on the whole nation is provided. Develop a guideline and SOPs and accreditations. This will guarantee the service to high quality screening services. Also, of course, you have to do social marketing and health education by outreach programs, mass awareness campaign, and the training of the staff who are the educators and the professional also. Of course, the advocacy component, which is either at the community level to enhance awareness between and also at the policy level, decision maker in the country. They have to know the importance of a screening and how it can affect the life of women. The last thing to complete this effort, to have to do some monitoring and evaluation by reporting and progress management, studies and research, and national database. I will comment on some aspects which are relevant maybe more for us like a radiologist. So infrastructure was supported by the Jordan Breast Cancer Program, as you see, to convert some neglected or less qualified units by providing the mammography machine, updating the mammography machine, converting the old processing into digital units. So this was supported by the Jordan Breast Cancer Program. Human resource and capacity building, as you already mentioned, training of the radiographer, the radiologist, and the multidisciplinary committee. We started with the radiologist, and slowly we included the pathologist, surgeon in the different workshops, so that we enhance the idea of multidisciplinary team. Even the biomedical engineering will include with us, who will guarantee the quality of the machine, mammography machine. Development of guidelines, we worked at the national level to develop a breast cancer diagnosis guideline, the radiographer manual, which we can be practical, and it's already started to be taught in the universities for radiographer sciences students, and the clinical breast exam manual. The idea was also to use our Healthcare Accreditation Council in Jordan, which is a local institution, which is also accredited by international institute like the ISQA, to give a breast unit-specific accreditation. So we had to put standards which can meet this requirement to guarantee a good quality breast imaging services. So you get the certificate that this breast unit service is accredited in this hospital, beside the general hospital accreditation. And already many centers in Jordan are accredited. And the mass awareness campaign, you are aware of it, and we started to do it at the level على مستوى the Arab World Hall. We have the الحملة الوطنية على مستوى الوطن العربي from the last 5 years. Egypt is taking part on it. So the message has reached to the women. I am happy now, with time we are seeing more women coming for screening, and they will tell us, we heard about it too much from you. We want to do the screening mammogram. This we could not talk about it about like 12, 13 years ago. National Mammography Database, as you have said, this is very important to start to collect data. We were deficient in this one, having our regional data from Jordan, and we established a registry we're trying to collect the data in Jordan into one body so we can analyze it and get more about the background situation in Jordan. I am always very proud to share our experience in the King Hussein Cancer Center Breast Imaging Unit, because I believe this was the first, like a national level and also in the nearby countries, to provide comprehensive breast imaging services and to support the kingdom and the region also. What was relevant for us is the education and training. We have different workshops for radiographer training. We have at least 1 month of training for anybody to be accredited by the healthcare accreditation training. We have training for radiologists. We'll give the basic training for radiologists, about 1 month of training. But the most important of all is the breast imaging fellowship. It is accredited by Arab board. They complete 1 year fellowship. We already have 6 graduates. And these are, I think they're already enhancing the idea of breast imaging service in Jordan, because they are better trained. Like when you can see 1 month of training, it just gives you an idea what's how to do mammography, what is the workup, what's the proper assessment. To share some statistics from our center also, you can see the increasing number of all the procedures done in King Hussein Cancer Center of the past years. The number of screening mammogram, there was a decrease in 2020 after the corona, but we still did mammogram. These were mainly the diagnostic cases, the new cases, the follow-up of breast cancer patients. And if you want to assess your screening and how do we stand now, we have to talk about cancer detection rate. This is average data from our center. It is about 0.012 per 1,000. And you know, on the average in the world, you are talking about 2 to 7,000 based on the age of the patient, if she's younger or older age. So this is an accepted number because these are pure screening cases. The women come by themselves, they have no symptoms. We could separate this number of data and to look how did we find cancer in these cases. We excluded them from the diagnostic or they had lump, were all excluded. And I believe this is promising, which means if we can perform screening in Jordan, we can find cancer in early stage. And this is the minimal cancer detection rate. We define it as a cancer less than 1 centimeter or in situ cancer. And also you can see the number increasing over the past years, which is also a reflection that the screening may be helpful in Jordan. Of course, you have to collect larger number of data. I will share the idea about mobile van mammography, which gives an idea of a screening. We have 2 mobile van mammography. The aim was to reach areas outside the city Amman, or where there is lack of mammography machine in some of the governments of Jordan, and also to provide financial support. So the Jordan Breast Cancer Program sponsored the mammography for the woman, so they do the mammogram in the mobile van in any part in Jordan. All the reading of the mammogram and the callback is done at our center in Amman at KHCC. And she needs biopsy, she's also sponsored. And this is a very important issue for women in Jordan because not all the women are covered by the Ministry of Health or the military services. So if she has to pay for it, that's another issue. And it's relatively costly for an average Jordanian person. So these are the governorates which we have in Jordan, different governorates, even in the city Amman. I will give the total number done since 2012. In May we started, the latest data from 2020, about 2,023 and 700 cases of screening mammogram, 208 cancers were diagnosed. When we started doing this, we could not refuse to do screening diagnostic mammography at the van, our first project in the first unit. So actually the woman will come to the man, they will do. They were like shy to tell her, we cannot do for you mammogram, go to the city, to the capital Amman. And so the distance is a cost factor. So we had to do. At the first 2 projects, we could not separate screening from diagnostic. We started this as we realized after 2014. So I collected the data for these pure screening cases which had no symptoms. And if we realized she had symptoms after that, we excluded them from our data. And you can see the cancer detection rate is 8 per 1,000. So this is going really with the international data, and this is a very important number to build our further projects or future projects and plans on it. I will share some numbers from one of the governments which we could. The average age was from 36 to 70. We start of 40, but every now and then they will have one lady who will come with a family history or certainly she wants to do starting mammogram earlier age. The average age of diagnosis was 51. And it was also important to build an average age of diagnosis. We had this impression that in Jordanian and maybe the Middle East, we start cancer at a younger age than in America or in Europe. And it's a limited sample of number, but really gives an idea for us, and we are using it in our new committee guideline. It's the average age of diagnosis is about 51 years. So it's relatively younger than one expected in the world. So we can starting mammography at age of 40, according to the American College of Radiologists, it's wise to start in Jordan based on these numbers. And this is again the same. Family history, it was interesting that most women who came for screening, they have some family history. So that's which makes a relatively also, it is a screening, but the woman had high risk group. So when they come, they are important to go to the van to do the mammogram. They had a family history. Does it make it more difficult to think about these women? Maybe they need further workup like ultrasound or even MRI in some cases. And that's why the false positive, the benign biopsy rate was.
Have you finished or you've done? Okay.
List, which we could sift with the case, and showing, because we are radiologists at Dr. Nuran, we have to show mammogram cases. So what you have to do, this is a small mass. If you want to do screening, remember this slide, you have to have the facility to do the further workup. You have to do good ultrasound, you have to have the good machine, train this stuff. All you need for the biopsy is the equipment, the needle, and the proper training, and you have to do the biopsy. And we always do biopsy, we put a clip and the coil with the pathology after. As you can see here, this is another case of 2009, as you can see, low-grade DCIS calcification. Also, we diagnosed 3 cases of lymphoma on average. From our case, it was interesting also with presenting as a lymphoma in the lymphadenopathy. One case was diagnostic. She had breast lymphoma also. This was interesting data. And thank you very much. We're looking to see you all in Jordan.
Thank you, Dr. Layla, for your presentation. Thank you very much. And now call for our next speaker from, let's see, the experience